Alrighty.
All right. Well, first off, if we were in Florida, nobody would have to have a jacket on. We could be on the beach, and it'd be nice and warm. We have a big national championship game tonight. Well, we just had a very, hopefully productive meeting with Secretary of Health and Human Services, Kathleen Sebelius, and Marilyn Tavener, who runs the Center for Medicare and Medicaid. And what we talked about was the President's new healthcare law. And what we brought up this fact is, I'm responsible for Florida families. And what I'm concerned about is their health care. In our state, as I talk to families, they're worried about their jobs, they're worried about the cost of living, and they're worried about education. So what we're worried about with this is, if the President's healthcare law is implemented in Florida with regard to the exchange or the expansion of the number of people covered by Medicaid, how would it impact each of our families, their health care cost, their access to quality care, and the access, quality, and cost of health care. So that's what I'm focused on. So we had a good meeting. We also talked about, we have 2 Medicaid waivers we've had up here for a little over a year. One for long-term care, one for expanding basic care. We've been working to try to get those implemented, so I've asked the Secretary if she would expedite those and get those finished. So that's what we've worked on. But let's all remember, growing government, it's never free. It always costs money. What we're talking about here with this Medicaid expansion is doubling the number of Medicaid recipients. We have 3.3 million recipients now. It'll almost double the number of recipients. On top of that, once you expand the program, as we all know, as you look up here at your fiscal cliff problem, as you expand something, you can't undo it. Once you do it, nobody says, I want to have less. Everybody would like to have more government. And finally, as you know, Florida's Agency for Healthcare Administration put out their estimate of what the expansion will cost just for Florida taxpayers, and it's over $26 billion. So, but I had hopefully a productive meeting. We're very focused on what we can do to improve the health care for Florida families. That's cost, that's access, and that's quality. So I'll be glad to answer your question.
Governor, it sounds like she didn't make a persuasive case to you. You've been talking about these costs for weeks now. What did she say at all about alleviating your concerns?
Well, you know, she was a governor. She knows the issues that we're dealing with. In our state, the Medicaid program is a $22 billion program. It's 30% of our budget. She knows that, just like in her budget, it was either tied to, can you put more money into healthcare or put more money into education? So she understands that. So we're planning on having more meetings to have a conversation. But she understands our concern about how do we make sure that we take care of Florida families, make sure whatever we do with regard to the President's new healthcare law, how do we make sure we're helping Florida families? And we want good access to healthcare, good quality healthcare, but at a price that they can afford.
So it sounds like nothing changed.
I think the goal is that we had a conversation. She understands, what our concerns are. We're hopefully gonna have a productive conversation. And the other thing, I'm very hopeful that the things that we're doing that are going to improve our Medicaid program for our families with these 2 waivers, that those will be expedited and get done promptly.
Governor, you face a deadline soon on a partnership exchange. Can you tell us what your thinking is on that at the moment?
Well,
Can you face the cameras, Governor?
Sure. Well, the question is the partnership with the federal government on the healthcare exchange. So again, what I've asked is, I need more information to make sure we understand how it's going to impact every Florida family. Is it going to impact their access to health care, their quality health care, their cost of health care? And as we do that, I'm going to do the best thing for Florida families. I want to make sure that every Florida family has access to health care. As you all know my background, I lived in public housing growing up. My parents didn't have health care. When my younger brother had a healthcare disease in his hip, we had to drive 200 miles to a Shriners Hospital in St. Louis from Kansas City. And that's the only place my parents could get free health care. And so I understand the need to have a quality healthcare safety net for every Florida family that can't afford their own health care. But we've got to do it at a price that Floridians can afford.
Governor, did she make any mention of the 100% request that you and other governors have asked for on Medicaid? Did she say she would review that again? Did you ask her to review that position?
Well, as we'd asked for as much flexibility as possible. We're going to have a conversation about how much flexibility they can give us. Look, every state is different. Florida is different than every other state. I want to make sure whatever program we implement in our state, and look, I want the right healthcare safety net for our citizens, but whatever we do, it's got to be a program that works for Florida. We cannot have an adverse impact on access to quality healthcare or the cost of healthcare. Well, my goal is we've got to understand how to make a good decision, but let's all remember, growing government is not free. What we're talking about is a doubling of the number of people on the Medicaid program, the healthcare safety net for those that can't afford it. We already have 3.3 million people. We want to make sure that program, our existing program, works well. This is a doubling. So, and look, what I'm worried about is I want to promise somebody in our state something that eventually the state can't afford. I'm worried about not the next 3 years, but the next 6 years, the next 7 years. I've got to take a long-term outlook in this regard. And as we know, the Florida Agency for Healthcare Administration put out their estimate over $20 billion just to Florida taxpayers.
One more. All right, thanks, guys.
Thanks. Have a great day. Move to Florida.